Hey, welcome Dark Side of Therapy with Eric Nance. We're going to do another video with Dr. Todd Grande, and this time we're going to look at what he says are the 8 signs of a good therapist counselor. So I'm going to take a look at what he's saying, offer my opinion as well. Dr. Grande is a therapist I enjoy listening to. He's got a lot of content on YouTube, so I'm going to do my best to see if I agree or disagree.
Today's question is, what are the signs of a good counselor? Now, when I use the word counselor here, I'm really referring to anyone who uses psychotherapy, any mental health clinician. So professional counselors, social workers, psychologists, and other people who use psychotherapy. So to answer this question, I'm going to give 8 signs of a good counselor. And these signs, of course, don't guarantee that somebody's a good counselor. They're just indications that I've seen throughout my career that tend to point to an effective mental health clinician. So let's get started with number 1. So the first one here is when a counselor is willing to challenge a client. So a lot of times, especially early in therapy, there's this temptation to kind of go along with whatever a client says. And sometimes this may be a good path, but sometimes it's not a good path.
Grande is spot on with this. I completely agree that a good therapist does challenge people, and challenges them for the following reason. It gets them to think. It gets them to explore other possibilities. And if you're unwilling as a therapist to confront or challenge somebody, I think you're doing them a real disservice. Now, the timing is important too, and you don't want to challenge them on every single thing they say. But I've worked with clients who've told me about therapists who are unwilling to challenge them and just simply say, Thinking, first of all, how boring is that? And secondly, if you never challenge a client, where's the growth going to occur? Because agreement is going to lead to seemingly stagnation.
But this other behavior is incongruent. Maybe your values are different than your behavior, and to point that out. I think sometimes too, for private practitioners, there's this temptation to not challenge because there's this concern that a client will leave. So a client stays as long as the counselor kind of goes along with everything. And again, going along with what a client says isn't always the wrong thing to do. But at some point, clients need to be challenged. They come in to get therapy to get another perspective on what's going on. And of course, the challenge doesn't have to be mean or impolite or anything, but just something that's pointing out a discrepancy, trying to offer that additional perspective. In the world of mental health counseling and the counseling community, we seem to see a lot of people with similar personality traits. And one of the personality traits I've noticed that's fairly common among counselors is agreeableness. So agreeableness is one of the big 5 traits on the 5-factor model. Openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. When someone's highly agreeable, they tend to agree with what other people say, they tend to trust people.
Grande is right about this too, and I don't think agreeableness is always a bad thing. I think it can actually foster a very good relationship. But to give you some reasons that he hasn't mentioned that I think people are agreeable in the role of therapy, one is that we're taught to do no harm to a client. And in my own supervision group, that comes up quite a lot. And I think there is a fear that if we're disagreeable or confrontational, we're going to hurt the client. And I strongly believe the opposite is true. By not being truthful and confrontational, we're going to hurt the client. I also think we struggle with understanding what people are capable of. And I see this a lot societally too. We tend to think people are less tough than they actually are. And I don't mean tough like tough. I mean that a person can't hear it or a person can't take it. And maybe our culture does, unfortunately, exploit some of that. But I think in the therapy room, the therapy space, it does not work like that. I don't discredit my clients by thinking they can't take what I'm going to say. My approach is typically gentle, but I'm going to say what I think they need to hear.
It can be challenging for them to contradict somebody or to challenge somebody. So I think what happens in counseling is people are trying to fight that trait. Counselors are trying to resist that trait. Their tendency is to be agreeable, and sometimes it pays to be disagreeable. So number 2, the second sign that somebody's a good counselor, is when they can come back to the original topic in counseling, in a session. So here's what I mean by this. It's easy to start talking about a symptom, a relationship, a situation that a client brings up, and then to get on a tangent. And I think this is perfectly okay. For that to lead to a tangent, it could lead to discussing something like a movie or a song or another relationship unrelated to the one that's mentioned, or different symptoms. But a good counselor keeps that original topic in mind and circles back to it, because whatever was being originally discussed may be important. Now, it may not be. The tangent may be a better way to go, of course.
I agree with Grande on this, because this does happen a lot. And I've noticed myself going off on tangents, and clients have had to call me back to the original topic. But I think to always in the back of your head be thinking about, okay, what's the crux of our discussion, or what's the theme of our therapy session today? I've said it enough to clients that I often hear clients say, okay, I'm getting off track now, I got to stop doing that. So I think I do a good job of putting that into practice, and I'm glad to see that he agrees too. But always coming back to the crux, the core of the issue, but allowing some latitude to go off on tangents, because it's going to happen. The problem becomes when you never get back to it, because this is a very bad trend that can occur between every session from here and out, and you don't want that. So getting back to his first point, number one, this is a great time to confront and say, let's get back to what we were talking about for you and me.
A lot of times I think what happens is once that tangent starts, the client and the counselor both forget what that original topic was in the first place, and then they follow that tangent out. So I don't think with this particular sign of a good counselor that the counselor has to have a good working memory. I think it's okay to say, look, we were talking about something originally here that led to what we're talking about now, and I don't remember what it is. Just that desire, just that awareness that there might be a need to get back to that topic, that's really the good sign, not necessarily having a perfect short-term memory or even a good short-term memory. So moving on to the third sign. The third sign is when a counselor is realistic. And what I mean here is that a lot of times, again, if we think about personality theory and what we see in counseling, we see individuals who are high in extroversion, specifically high in positive emotions, and low in neuroticism, although that's not always the case, certainly. And one facet specifically with neuroticism is negative emotions. So we see low negative emotions. And when somebody has high positive emotions and low negative emotions, it's more difficult for that person to be realistic, especially about difficult topics. You may have heard before on the topic of depression that people who are depressed tend to be more realistic. And I don't think certainly a counselor needs to be depressed. That wouldn't be helpful. But to be realistic.
I agree with Grande on this too. And this is one that I have a lot of experience with, because I've done a lot of team meetings and consultations in my career. And a lot of what I see is younger therapists who come in, and they tend to be the ones that get stuck with the very complex cases where there's generational poverty, generational trauma, just so much going on. And they don't have the first clue of what to do. And I think they sort of overextend themselves and believe they're going to be more capable than they are. And I think over time they need to learn to be more realistic, that you're not going to fix 100 years of programming with your client. And whether it's generational or not, you're not going to fix a problem that's that big. What you can hope to do is be present, be a positive influence. You're going to be able to offer something. But to get realistic about what you can actually do, I think the older we get as therapists too, the more we realize how little control we actually have. In my grad school program, I made the mistake one time of sending out an email that said we have far less control than we think we do. I said it a little more snide than that. I got a lot of mean emails back, but it is true. We have such little power. We have such little power. We have influence, but we don't have power. And I think understanding some of the limits of what we can do is really important. That doesn't mean we don't care, and it doesn't mean we're being lazy. It means we are being realistic, as Grande talks about.
Be careful how high the positive emotions are expressed, enough so that the individual can be realistic about what's going on with the client. Clients come in with a lot of different problems, and they don't necessarily need a counselor who's always positive, who always thinks that things are going to work out. Sometimes things aren't going to work out, and it's good to be a realist about those situations. So now maybe number 4, the fourth sign that somebody's a good counselor. This is curiosity, specifically intellectual curiosity, the facet that we see on the trait of openness to experience. Now this one's a bit of a balancing game, because I think it's good if a counselor can be curious about a client's symptoms and their history and their narrative and really everything the client wants to discuss. But if you take it too far, if you take curiosity too far, you're always investigating and never actually getting to any of the working parts of therapy. And if you take it even further than that, it ends up being kind of invasive. So what I mean here is there's just a limit to how many details a counselor needs to know.
I think Grande's right about this too, and I'm actually enjoying how many of these things I'm agreeing with here. I think curiosity is absolutely huge because we want to understand what our client's going through. We want to have some idea of their struggle. Now, what he's also saying is, yeah, we can take it too far because there's some things we should know. And I think to obliterate a client by just hammering them with question after question is not a good thing. But to be curious about their life, to be curious about what they're going through, to be curious about the symptoms they report, these are all very, very important things. Bessel van der Kolk, one of the leaders in trauma work and research, said at a training I went to with him that we do too much talking in America in therapy, that we talk, and we talk stuff to death, and we probably do. So I always go back to what he said. And I think the quote is, keep your voyeuristic tendencies to yourself. Now, I half agree with that and I half don't, because I don't think you can be a therapist without having some degree of what's happening with your clients, and that's only going to happen through observation and question. But to his point, and I think to Grande's point too, we can learn things just by observing. I've learned a lot about my clients just through watching how they interact with me. Sometimes that's way more valuable than asking questions. And so do not diminish the power of presence with people, because presence can teach us a lot. Again, he's not really acknowledging that yet, but I think just the presence and the interaction are really powerful things to be in tune with.
The logistics, the basics of that trauma should certainly be communicated, but the details aren't always necessary. So intellectual curiosity really has to be balanced a bit. But if somebody can get that balance tuned in correctly, I think that's a sign of a good counselor. So moving to the fifth sign of a good counselor. This one is a counselor who reads the research literature. And I would put this kind of under high conscientiousness. If a counselor is very conscientious, they're more likely to take a look at the research literature. So imagine if a counselor has a new client and the client has a disorder that the counselor is unfamiliar with. Well, what is the treatment going to be based on? What is that counselor's understanding of the psychopathology going to be based on? Experience? Just hoping for good luck? I mean, at some point the research has to be involved. And I think that a counselor that gets a new client, say they're dealing with like rapid cycling bipolar, and they've never dealt with that before, and they go and they take a look at one or two articles before the next session, to me that's a very good indicator of a good counselor. I've seen situations before where clients ask counselors about the disorder. They say something like, well, what do you know about generalized anxiety disorder? Or what do you know about avoidant personality disorder?
I don't know that I agree that being well researched is necessarily a sign of a good counselor. There's an area that I might disagree with, because I know lots of therapists that are very well read, very well researched, who don't communicate well at all, and yet they are therapists. They tend to be fairly black and white and sort of dogmatic in their approach, like we talked about in a different video. And it's certainly not all of them, but to say that doing research makes you a good therapist, no. Now, is it important? Absolutely. And I think more important than just the research is getting trained in these different modalities. And it's tough because you may get somebody with rapid cycling bipolar disorder, you know nothing about it. I don't know if that would even be a good fit if you have no understanding of the disorder and you've never treated anybody with that disorder, or I should say haven't been trained at all. Obviously you have to start somewhere, and it's going to depend on the severity of the disorder. But no, I don't think being well researched makes you a good therapist. We should all be researched, though, in everything we specialize in and everything we practice. And that can come through trainings, books, seminars, reading research articles. So I do agree that these are good things to do that every therapist should be doing, but not necessarily going to make you a good therapist or the sign of a good therapist.
What do you know about generalized anxiety disorder? Or what do you know about avoidant personality disorder? and the counselor will respond, well, I've had other clients that had similar presentations, or I went to a training one time and that was discussed. And that's all well and good. But if a counselor responds by saying, well, I don't know a lot about it, but I'm going to go home tonight or this week and read the literature. I'm going to read up on avoidant personality disorder or generalized anxiety disorder or whatever the disorder is. Again, I just think that's a really good sign. That's a sign of a conscientious counselor who's understanding their limits, and they know they need more information to be effective. The sixth sign of a good counselor is a counselor that knows when to stop talking. And this is, I think, particularly important as counselors are relatively new in the field. Now, when somebody's learning how to be a counselor, there's this real pressure in terms of what the counselor says. Now, this makes sense. If a counselor is going through the educational process and they're recording their sessions and they're doing role plays and everything, and they don't say anything, then there's nothing to grade. There's nothing to look at and say, well, this is the skill you used, or this is what you could have done. So the bias there, of course, which this makes sense, is we want to hear that somebody's saying something. So talking is good. But when you're in clinical practice, this type of mentality, this idea that you have to fill the silence with words, can really turn on you quickly as a counselor. I think it's valuable to know what techniques to use and what to say and to have responses that are helpful. But it's also valuable just to stop talking sometimes.
He's spot on here. And in fact, every therapist that is in practice should really embrace the power of silence. Now, this can be uncomfortable, and I've had clients say to me, I hate this silence. But what's wrong with it? Let's let the ideas simmer. Let's be present with each other. See, very, very, very few of us, especially in this day of communication, where we're always communicating verbally, in person, digitally, we're always communicating with each other, trying to fill every space we can. I think there's real wonderment that occurs in moments when we're not talking, and I also think it gives the therapist a chance to embrace some of the pain the client's experiencing. Just sitting there with the pain. We don't do that very often. So I think he's absolutely right. You don't often hear about silence as a therapeutic technique because it's so passive, I feel. And it's not passive at all. It actually requires a lot of energy to be silent and to be quiet and to let things again simmer and kind of go through your brain as it's going through the client's brain and then coming back together later and talking about it. And I think, again, this is something you can set up very early on in your treatment, which is as part of the agreement, there's going to be periods of silence. And you're going to have to figure out how to deal with that as my client. So putting that in the contract, I think, is a great idea. So again, later on, there's no confusion about why is my therapist not saying anything? Oh, that's right. That's going to happen from time to time.
Sometimes a client will say something, and the best response is silence. Or if you don't have a quick response, if you don't have something that's helpful to say, I think it's perfectly okay to say, I don't know how to answer that. Give me a moment. I need to process that. So I guess what I'm saying here with this sixth sign of a good counselor is that thinking is important. And sometimes in order to be thinking, we have to stop talking. And it's okay to do that, and it's okay to tell a client, look, I just need a minute to figure this out. It doesn't seem like something that would make a good recording or make a good test session for demonstrating educational achievement or anything, but it can be very effective counseling. A good counselor, again, needs to know their boundaries, they need to know their limits, and if they don't have a response or they don't have a good response, sometimes it's better just to wait. So now moving on to the seventh sign of a good counselor. This is a counselor that can promote independence. They can help a client to become independent and to use the counseling skills between sessions, but also effectively communicate and understand when long-term therapy is necessary. Now, I know for some, long-term therapy is a little controversial. Some counselors don't believe in long-term therapy, but I have definitely seen situations, I've seen presentations that require many years of therapy. There's just no way of getting around this. And when that is the case, a good counselor needs to effectively communicate that, but at the same time be willing, of course, for the client to reach a point where they don't need therapy anymore. Like recognize when it's time to end therapy. So again, keeping in mind promoting of independence.
I really agree with this one, because I think so often what happens is therapy gets stale and we keep clients in therapy because we say to ourselves, well, it's a safe place for them to be. And I've heard this echoed in lots of meetings I've been at, lots of consultations. And so I think this is largely a thing that gets left out of therapy, which is helping create independence. Because we ultimately want to have them look at us as unnecessary. I mean, that's really how we start, right? We're much more necessary in the beginning than we should be in the end. Now, where it's going to get debatable here is how long this actually takes. And that is completely based on the person you're dealing with, the client you're dealing with, and the diagnostic category. So, for example, some personality disorders, people theorize these can take 4 or 5 years to really get the person to the point that they are functioning well, which I would think means independence too. But I love the fact that he's saying that ought to be something we focus on, is getting them independent and focusing on the homework too. This is a huge piece of therapy I think a lot of clients don't get to be a part of, because if you're not assigning things to your client between sessions, it's sort of like the growth stops there and then we pick up again in a week. A lot gets lost between sessions if they're not doing something that connects them back to the therapy session they're coming to. So in this case, I couldn't agree more.
Keeping in mind promoting of independence and also balancing that with the need for long-term therapy. So the 8th sign of a good counselor is a counselor that can see something that the client's trying to express and point it out. So this is a counselor who's not oblivious. But again, just like several of these points, there's a balance here. This doesn't mean pointing everything out that the client does and saying, hey, what's going on there? Hey, what's going on there? Every little nonverbal behavior. But rather, understanding when the client's trying to communicate something, but they don't want to directly say it. Right? And that happens really quite often in therapy. A client comes in and maybe they're a little down, a little depressed, or maybe they've been using substances and they don't want to communicate that. But they're trying to communicate it in a way, subtly, and some counselors just completely miss this communication. Now, this is an important balance. Again, you don't want to jump on every little detail, as I mentioned before. If a client taps their foot or crosses their arms or something, that doesn't always mean something, but there are a lot of different ways to communicate.
Really another great point here that Grande makes, and this is actually a strategy that we use in personality disorder work, which is a lot of reflection, how things appear to be. It seems like you might be angry today. It seems like what I said really upset you. He's not talking necessarily about that, but he is talking about being in tune to what's happening. And even the client may not be able to see it. I think there's so much magic and wonderfulness in being able to say to somebody, I wonder if it could be this. Because then he's right, you are offering them a bridge to talk about the thing maybe they don't want to talk about. Now, you do therapy long enough and you get pretty good at reading body language, most of us. And there are probably some therapists that maybe never get good at that. But I have spent a lot of my career really watching the way people communicate. And I've had clients who have actually said to me, you know me so well. I can think of times when I will say to a client, there's something you don't want to tell me today. Or there's something that you seem uncomfortable with. And sometimes you get the damn. But that's exactly what he's talking about, is again, helping them say the thing they don't want to. And sometimes we have to say it for them. And we're not saying it with certainty, but we're opening up the window of, here's what I think it is. If you want to go forward, I'm ready to listen.
Where somebody looks, if they're looking down, facial expressions. If a client is normally fairly talkative, but then in one particular session they're not very talkative, a counselor needs to be able to pick this up and know when it's appropriate to say, hey, I noticed your mood's a little off today. Is there something going on that I need to know about? Or is there something you need to tell me? And the client may say, no, everything's fine, and that's okay. A counselor at that point can say, oh, I just thought you were looking down, you looked a little sad. I just wanted to point that out. I just wanted to make sure everything was okay. And the vast majority of the time, I think clients appreciate that a counselor is paying attention. And they're aware and trying to be sensitive to what's being communicated directly and indirectly. Sometimes counselors get it wrong, But again, I think it's a good indication when a counselor is trying to see what somebody's communicating and they're willing to interject and ask about what may be going on there. So these are 8 signs that I believe are normally associated with good counseling. As I mentioned before, none of these signs, or even all of them together, don't make a good counselor by definition. These are just indications of good counseling.
So thank you for joining me in my reaction to Dr. Todd Grande's definition of 8 good signs of a therapist, most of which I agree with. I agree with, I think, 7 out of 8, and even the one I didn't agree with so much, I think there's some room for variance there. But I think overall, he's done a very effective job of identifying 8 really good traits in a therapist. Now, obviously, we could expand this category exponentially and look at 1,000 different categories. But in terms of just these 8, if I was going to therapy myself, these are 8 things, or at least 7, that I would like to see used successfully. So if my therapist had 7 or 8 of these traits, I think I'd feel pretty good about myself. So this is Eric Nance, Dark Side of Therapy podcast. Thank you so much for joining us. If you like this video, please hit like, and as always, please subscribe.